Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, the next scale is Rockall and Baylor score. This Rockall and Baylor score is also used to predict the rebleeding and mortality in peptic ulcer. This Rockall-Baylor score has two components. Rockall-Baylor score has pre-endoscopic scores are present and even post-endoscopic scores. It consists of pre-endoscopic scores and post-endoscopic scores. What are the components of Rockall-Baylor's score? The main components of Rockall-Baylor score Rockall-Baylor score includes age, shock, diagnosis at the time of the biopsy, and even endoscopic stigmata or recent hemorrhage which is present. So components are, before age we also have comorbidity. If the patient has any comorbidity, then age, shock, diagnosis at the time of at the time of endoscopy, and endoscopic stigmata of recent hemorrhage. So these are the components. As we said, we have two things. One, we have pre-endoscopic scores and post-endoscopic scores. First, we see pre-endoscopic scores. These pre-endoscopic scores, in the pre-endoscopic scores, among all these diagnosis at the time of endoscopy and endoscopic stigmata is not taken into account. Only the comorbidity, age, and shock are taken into account in the pre-endoscopic scores. So in pre-endoscopic scores, we take into account the comorbidity, age, and shock of the individual, and a score of 0.7 is associated. If the score is present between 0.0 to 7, that means there is stepwise increase in mortality is seen. That is, the mortality rate is more for 0 followed by 2 followed by 1, like that. Sorry, 0, 1, 2, 3, 4, 5, 6, 7. As the numbers increases, the mortality increases. This is pre-endoscopic score. Whereas the post-endoscopic score mainly includes the other two. That is endoscopic criteria at the diagnosis, and it also includes the stigmata of the recent hemorrhage. Okay, and in the post endoscopic score we mainly include a score of 0 to 11, right? The initial or pre endoscopic Rockall scoring system, this is important because it is predicting the mortality of the individual, or the risk of the mortality is predicted, whereas the complete Rockall score along with the post endoscopic Rockall score, complete Rockall score will predict the peptic ulcer rebleeding.
thank you and thank you for watching.